Hi, my name is Annie West Honart, and my poster is entitled Gestational Weight Gain and Neonatal Outcomes by Maternal HIV Status in an Urban Zambian Cohort. Small for gestational age, or SGA, is associated with adverse neonatal and early childhood outcomes in low and middle income countries. Low maternal pre-pregnancy body mass index and suboptimal gestational weight gain are associated with an increased risk of neonatal morbidity, including SGA infants. Maternal HIV infection is an independent risk factor for poor nutritional status. The effect of HIV infection on nutritional status during pregnancy and resulting neonatal outcomes, including SGA, is not well studied, particularly in low and middle income countries. The objective of our work was to determine whether maternal HIV infection is associated with low gestational weight gain and an increased risk of small for gestational age infants in a Zambian population. This is a retrospective secondary analysis using data from the Zambian preterm birth prevention study, otherwise known as ZAPS, a prospective cohort of pregnant women between 2015 and 2017. Eligible women were greater than or equal to 18 years old with a viable singleton intrauterine pregnancy on ultrasound at less than 24 weeks gestation, planning to deliver at University Teaching Hospital in Lusaka. Estimated due date and gestational age were calculated by ultrasound at enrollment using intergrowth 21st. Maternal measurements, including height and weight, were obtained at enrollment and each subsequent prenatal visit. Gestational weight gain was calculated using maternal weight at enrollment and the final prenatal care visit at 36 weeks gestation. Gestational weight gain was defined as low, average, or high based on enrollment BMI and Institute of Medicine BMI guidelines. Small for gestational age was defined as birth weight less than 10th percentile by gestational age using intergrowth 21st. Our primary outcome was SGA. Our secondary outcome was maternal gestational weight gain. Logistic regression models were used to estimate the association between HIV status, gestational weight gain category, and SGA. A stepwise regression with backwards elimination was performed to select an adjusted model. Main effects were retained if the p-value was less than 0.05. 1,450 women were enrolled in ZAPS. 1,216 were retained at delivery. Birth weight data were available for 1,178 infants. 828 women had maternal gestational weight gain data, and of these, 116 women had SGA infants. Table 1 shows characteristics for the ZAPS cohort by HIV status. HIV-infected women were older, more likely to be multiparous, have less than 8 years of education, and have low gestational weight gain compared to unaffected women. Trimester and BMI at enrollment, mid-upper arm circumference, marital status, and hours spent on feet were the same between groups. In multivariable logistic regression models, adjusting for HIV status, total gestational weight gain, maternal age, parity, and education, only low gestational weight gain was associated with SGA, as shown in Table 2. In conclusion, HIV infection is not associated with an increased risk of SGA infants in an urban Zambian population. Low gestational weight gain is an independent risk factor for SGA, and efforts to optimize maternal nutritional status during pregnancy should therefore include women with suboptimal gestational weight gain.